everybody. Welcome to another Q&A session with Dr. Jay. It's March 2022. I can't believe it. 2022 is flying by, right? Anyway, so think about March. March is actually National Sleep Awareness Month. And as a dentist, how that affects us is we see a lot of sleep apnea patients. So I figured this was a good topic to kind of shine some light on, peel back that onion and kind of figure out what it's all about. So sleep apnea is a disease that, according to the American Academy of Sleep Medicine, affects about 25 million Americans. So that's a lot of people not getting enough sleep, right? Because they have some kind of sleep apnea that's disturbing their nighttime, shut eye, beauty sleep, however you want to call it, and it's affecting how they're functioning during the day. Sleep can have a lot of detrimental effects that are very insidious. And they kind of creep up on you because we kind of overlook the idea of like, hey, I'm not getting enough sleep, let me drink more coffee. I'm not getting enough sleep, let me drink some more energy drinks because I'm feeling, like not like I'm energized enough to kind of face the challenges of the day head on. What we don't realize is we're just kind of treating the symptoms of the issue. We're not treating the cause, which is we need better sleep, we need better rest. Sometimes we'll be switching our mattress, maybe buying a better bed, a bed that can bounce a wine glass off without you moving, and those are kind of tricks that, I feel like more like, things that are kind of like, not a cure for the issue, but just again, like just treating a symptom. And of course we all like shopping, right? But again, by that time, we're not treating the cause and the cause just keeps getting worse. Sleep is affected by a lot of things. It may be being male is one of them, being overweight, having a large tongue, having low tone in the muscles of the face and the neck, the throat area. Those things, apart from a bevy of other factors, can be attributed to causing sleep apnea. There can be some hereditary issues. Normally you see people who are suffering from sleep apnea, they snore a lot, loudly disturbed. If your sleep is disturbed next to somebody who snores really loudly, it might be a good idea to have them checked for sleep apnea. Getting a sleep study is a very good way to get checked because a lot of the insurances are nowadays covering sleep studies, and they can absolutely tell you, hey, is your sleep apnea mild, moderate, severe, what level it is, how many times are you getting up during the middle of the night, how much your sleep is disturbed, and give you a better idea what your sleep apnea is causing, how it's affecting your life. Now, sleep apnea also has a lot of general negative effects on the body because when you're not getting enough air, you're apneic, you're not breathing, and you kind of wake up in the middle of the night gasping for a breath. What you don't realize is that's happening because your body's not getting enough oxygen. Now, when the oxygen level in your blood drops, the body takes a lot of compensatory measures, which may eventually lead to increased blood pressure. It'll affect your heart rate. It'll affect just general metabolism in the body and cause a lot of other metabolic diseases just because you're not getting enough, good rest. You're not getting enough oxygen, which is kind of down the line causing all of these other issues. And because this happens so slowly, so insidiously, we tend to overlook some of these common things, right? Like, oh, I'm just sleepy, I'm just tired, I just didn't sleep well last night. But we don't realize that is not a one-off thing. It's happening over days, weeks, months, sometimes years. And by the time we realize all the damage that's happened, we've got a lot of other disease to catch up on. Now we're having a buffet of medicines we're kind of using to manage one thing that could have been so easily managed, by taking care of the cause itself, which is treating the sleep apnea. So again, coming back to why I myself as a dentist am discussing about sleep apnea and how it affects us in the dental profession is, according to the Journal of Dental Research, it's been proven that people who have sleep apnea have a lot more issues with their temporomandibular joints, which is commonly known as the TMJ. Now we have two TMJ joints, which is one's on the right side, one's on the left side. And people who have sleep apnea have a much higher incidence. In fact, 70% higher chance of developing TM joint disorders. And TM joint disorders can be very painful. It may limit your mouth opening. It may affect your ability to eat properly. It may cause discomfort when you're eating, chewing, talking. And in fact, it may even cause arthritic changes in the jaw joint. Sometimes you get like locked jaw where sometimes you yawn and you're not able to close your jaw anymore. I'm sure some of you have heard that happen. And that's because all related to the temporomandibular joint disorders, or the TM joint, as people are commonly referred to as that. Another thing that's commonly seen with sleep apnea is affecting us dentally is bruxism, or parafunctional habits, commonly known as grinding or clenching. And people who have the sleep apnea are 31% more likely, according to the dental research, shows that there are higher incidence of clenching, grinding, causing more damage to their enamel of their teeth, causing the teeth to break, to fracture. Sometimes the bruxism itself leads to TM joint disorders, causing other bad effects related to the dentition. According to the Journal of Periodontology, it has also been shown that people who have sleep apnea, almost 65% of them suffer from some form of periodontal disease, and almost 30 to 35% suffer from a higher risk of gum disease. Now, why does that happen? See, what happens is when you're getting sleep apnea, you're not getting enough oxygen. You're not getting the air to be able to breathe. So what people end up doing is, because they're asleep, the body tries to compensate by breathing with the mouth open. When you're breathing with your mouth open, your mouth tends to dry out very, very rapidly. And a drier mouth has a higher chance of causing the bad bacteria to increase in your mouth, in your oral cavity, because the mouth is dry, so there is not enough saliva to kind of give the protection that you need for your gums and your teeth. So those bad bacteria cause higher gum disease, higher periodontal disease, cause increased cavities in the mouth, and a whole host of other diseases that you don't really want. So with higher gum disease, higher periodontal disease, increased clenching, increased grinding habits, more TM joint disorders. I mean, these are all just a multitude of reasons why you would want to avoid, suffering from sleep apnea, and making sure that you're taking the necessary steps to get yourself checked out, or getting a sleep study done to find out if you are in fact having sleep apnea, and coming in and having us take a look at it, look at your report, and figuring out what is the best solution to treat the sleep apnea. But before we move on to the treatment here, I would also like to point out that sleep apnea can also affect children between the ages of 2 to 4, sometimes 8. 4% of those kids can also suffer from sleep apnea, and they end up having the same issues as adults. Higher incidence of cavities, higher gum disease. And you want to keep an eye on your kids in terms of making sure that they're not suffering from sleep apnea as well. And if you hear a child is snoring, it's important to get them checked out. If they have increased tonsils or adenoids, or why is the child snoring, and getting a proper health checkup is super important for those kids as well. All right, so how do we figure out if a patient is suffering from sleep apnea? Well, the sleep study is the most common thing, but what if it's a child and they're not gonna, really tolerate the sleep study that well, or they're not able to get the sleep study done? The easier things that you can look for in your own home is signs of snoring, or loud noises when they're sleeping and they're just snoring so loudly they wake you up. Noises from clenching or grinding. Sometimes kids clench and grind their teeth so loud you can hear them from 2 rooms away. And you want to make sure that if that is happening, you want to check your kids' teeth when they're brushing. Brush their teeth for them. Look at their cheeks. Look at their tongue. See, does it look raw? Does it look like it has been chewed up? Are easy signs to look for to make sure that are they clenching or grinding. If there's any tightness or pain in the jaw joints, if there is tenderness in the muscles of the jaw or in the temples, that kind of points to indicates that, okay, these people might be suffering from some kind of clenching or grinding. Having a headache or a dull headache, or kind of like pain in the forehead area or the temple area when they wake up in the morning, kind of letting you know that these muscles were overworked at night when the person was sleeping. So if you're having these symptoms, it's important to kind of bring these issues to the attention of your dentist, because we really want your feedback, because when you give us the information, that's when we're able to kind of give a better feedback, take that information, make the right diagnosis, and point you in the right direction, whether you need a sleep study and what are the other treatment options that are available for treating sleep apnea. The treatment options most commonly in this day and age are there's a variety of treatment options. The most common thing that's prescribed by the medical profession is the CPAP, or the continuous positive airway pressure, which is a machine that regulates the airflow through your nose and helps kind of make sure that you're getting the oxygen delivered to your lungs that you need to make sure that you're breathing well and getting the good night of rest. A lot of people are very, very happy with their CPAP machine, and it works really well for them. Of course, there are maintenance that you have to do for your CPAP to make sure the air is properly humidified, to make sure it doesn't dry you out. But the machines work very, very effectively. Now, for some people, the CPAP machine is not that much tolerated because, of course, it is a device. There is some noise associated with it. It is a device that is connected to your body, so that limits your movement at night when you're sleeping. And those may be the things that kind of want you to research alternative treatment options. We at the dental office are able to make different kinds of prostheses that you're able to wear at night that helps position your jaw differently. They're non-invasive, they're easily removable, but they're very, very comfortable compared to some other devices that you may be using to treat your sleep apnea. Now, these devices help position your lower jaw in a different position in order to open up the airway and have better airflow through in order to give proper oxygenation to your lungs. These are called sleep apnea devices. These are fabricated by the dentist. We take custom impressions for you, send them to a certified laboratory that they're custom fabricated for you, and when they're sent back to us, when we deliver them to you, we titrate them to make sure that you are at the right measurement for your sleep apnea and that you're getting the most effectiveness out of that device and it's working well for you and getting the good night's rest. Of course, this has to be taken in conjunction with regular sleep apnea sleep studies that you need to do once every year or once every 2 years in order to make sure that there is clinically proven signs of improvement that you're having from your sleep study. Now, custom-made sleep apnea devices are definitely the way to go, though you may be able to research options online, but these may or may not be custom fabricated for you, and if they're not custom fabricated for you, they're not designed for your comfort, they may not work as well. So if you do find these things, please come in, let us know. We'd be happy to check out what exactly the devices that you're talking about and give you our feedback on it. And if you decide to go with one of our devices, we'd be happy to take your measurements for you and fabricate. It does not take that long. Again, it's very, very minimally invasive. It is not as limitational as a CPAP device may be, and may offer you the freedom that you're looking for when you're having your beauty sleep at night. So hopefully that was informational, educational, and got you some good information during Sleep Awareness Month in March. If you're looking for a dentist, we are always welcoming new patients. You can give us a call at Media Dental Associates, Bootway Dental, and Conshohocken Dental Arts. Our staff is ready and waiting to take care of you and set up your first appointment with us and give you an amazing experience. Thanks for watching and take care.